Good morning, America. Again, this is Dr. Rick, the Maverick Doctor. I'll try to go on a little bit with my story and how I've traveled through healthcare in the last nearly 20 years. It's been a rough ride sometimes. When I told you that my loved one had AIDS, that's really a crushing blow when you first hear it. And being a physician and knowing how close Lori was to death, it was extremely hard to me every day, knowing what our chances were at that time. They weren't worth much. Sometimes I'm going to get a little maudlin with you. I have always worn my heart on my sleeve, and if you want to know what that means, it means your heart's close to the surface. Us right-brained people have life, I think, a little bit more difficult than the left-brained people. Right-brained people, when they talk about things, when I'm talking about Lori and kneeling before her and asking her to get married, I am right back at that moment. I am at that moment exactly. And I feel every emotion and heartache I feel that I felt right back then. I have a interesting memory. I didn't know what it was for years, but I saw in a television program some time ago. They described what pretty much fit me to a T. They called it a geographic memory. Some people call it photographic memory. I don't have a photographic memory. I can't look at a page and repeat it to you. But I can tell you exactly what room I saw a particular patient in from 30 or 40 years ago. And I can tell you everything about that. And so that's how I can recall these things so fervently and pull it out of my heart. You may wonder what these bracelets I wear. I wear bracelets every day. It says, God is big enough. God is everything. I wear a bracelet that says, I protect animals, our heritage, my wildlife, my future. I think it's necessary that we take care of our fellow men and animals. Try to interrupt that so I can get my heart a little bit more under control. Anyway, Lori and I went for months, and it was really, really a struggle knowing whether Lori was going to be alive or not. Just cooking Lori's meal was hard because I always cooked things, so there was hardly anything left. I didn't want a chance for getting some foodborne organism that was going to end her life. And Lori liked to eat meat, and she liked hamburger and steak, and she liked it medium rare. And she'd ask me, will you make me a steak, Rick, or will you make me a hamburger? And I'd say, sure. And I bring it back in. She said, Rick, this is almost burnt to a crisp. And I'd say, that's the way it's going to be for the next year or two, or however longer it has to be. I'm not serving you something that doesn't have everything, all the bacteria dead on it. And boy, was it dead. It probably was tasteless, but she still ate it. One of the problems, we had saved some money. I'd saved money from working in the emergency department, so we had a big bag of money under the sink. And I say laughingly under the sink, but it really was under the sink. I had saved a bunch of money from working in the emergency department. Couldn't have an account anymore because our good old federal government had started confiscating my wages. I had been behind in taxes by $6,000 at a time when I went back to Minnesota to start practicing medicine again. And of course, our good old government, they changed that $6,000 to $26,000. I hadn't planned on practicing medicine again for a while, but I decided I'd better pay that off. So how they work things, and I'm sorry to get off track here, but it's to inject a little humor into a serious situation. How they work things is when you go to pay that off, they start doing penalties and interest on the money. And so every day you're a little further in debt, no matter how much you make. And I went and talked to somebody. They said, well, you can't ever get out of this without just declaring bankruptcy or something like that. So anyway, I really couldn't work without them confiscating everything. The moral of that story is pretty soon it got to where Lori and I had a lot of trouble paying for medications. Medications for AIDS were expensive, very expensive, some of them. Not quite the sky-high prices the drug companies put on us today. Of course, today they know they can charge anything to a person who's trying to save their loved one's life. That is just the fact how things are, and that's the fact of how our congressional leaders let it be. They don't care. It started becoming evident that pretty soon Lori and I were not going to be able to have enough money to pay for medications. And here I am, a physician, can't work, thanks to our U.S. government. Good old people that they are, they solve everybody's problems. And I'm trying to figure out, how do I pay for my wife's medications? I went from one drugstore to the next. I told them what our problem was, what our plight was. I said, we're not out of money yet, but we're going to be very shortly. And pretty soon it was getting so that Lori and I knew it was going to be impossible for her to keep taking her medications. Lori was religious about this. Over a 2-year time period, she didn't miss her medications one time. And she was religious about the time of day. She did everything according to the book and the way the doctors instructed her. And finally, it became obvious that we couldn't get help. We couldn't find help anymore. We couldn't go to social services. We couldn't get the most inexpensive medical care there was because we couldn't afford it. You know, they had medication for people in poverty. Well, we were so far below the poverty level, they didn't have a scale that low for people to be put into. So I started bringing a notebook to the drugstore when we went and picked up Lori's books. And I know it's going to sound crazy to you. What's the doctor doing casing a drugstore? But that's what I was doing. I was bringing a notebook to the drugstores, and I was watching where the medications were taken out of, what drawer. I wrote this down. I wrote down the security systems. I wrote down everything that I thought could help me get into that drug floor quickly and to steal medications and to get out. Lori said, Rick, you can't be robbing drugstores. But I built up a pretty good idea and system where I thought I could get into these drugstores and get out of them. And I had several drugstores lined up, and Lori said one day, Rick, what if you get killed? What if you get killed and then I don't have you taking care of me? She says, you're signing a death sentence for me too, you know. And when I thought about that, I realized that really I can't go robbing drugstores, probably, but that was the only thought I had at that time. I hope you have a blessed day, and I'm trying to keep my emotions under control, but it's difficult. God bless you, America. I'll talk to you soon.